Let's talk a little bit about recovery after tummy tuck. There's really 4 phases: acute, limited, cautious, and full recovery. That acute phase is that first, right after surgery phase. You need narcotic pain medications for some patients, although a good number of patients don't need them. We prefer you don't take them if you don't need them. It's just safer. It lasts for about 1 to 2 weeks. If we've placed drains, drains are in for that period of time, although most of our patients, we choose not to use drains. That's case-by-case basis. We don't want you doing anything exercise-wise. We don't want you going to work at that period of time. That's when you're going to need help if you're a mom with kids. Older kids taking care of younger kids, or somebody at home if the kids are young and you need help. That's followed by that limited phase, which starts really after that acute phase, anywhere from a couple of days to 2 weeks after surgery. And that's where you're feeling good, you're ready to kind of get back to normal things, but we're going to have you really limit those activities. Office work is fine if you have a desk job. Taking care of kids is fine. But nothing real physical yet. We're not going to the gym or anything like that. Nothing more than say walking, walking for a little bit of exercise. And then there's that cautious phase where you feel recovered. That starts at about 3 weeks. You feel recovered. You feel like you really could go back to the gym, but we got to be careful. Physical work starts at that point. If you've got a moderately physical job, that's okay to do. But really only low impact kinds of things at the gym, light exercising with the legs and arms, essentially. And then we get to 6 weeks, and that's where you're full, and that's where I really don't have any restrictions for you, no matter what job you're doing, no matter what kinds of exercises you're doing. You might want to work yourself back into those exercises, but I've got no concerns with you doing them. Let's talk a little bit about why these phases. So the first, that acute phase, that's really where a risk of bleeding, tearing, internal sutures, those kinds of things. And we just don't want to, we want to get a little bit of healing behind us before we're ready to start doing much. That's the risk where if we overdo it, there's a risk of another trip back to the operating room to fix something. Then there's that limited phase, and that's where we're trying to let the scar tissue get a little bit stronger. It takes about 6 weeks before the scar is fully strong, and that's at the muscle repair level, and that's at the skin level. So when we get in that intermediate, limited, cautious phase, we just don't want to push it too hard and get the best scar we can, and just make sure that muscle's healing the way we want it to. And then when we get to 6 weeks and we feel like all of the scar tissue is strong enough, it's ready to go. So it's just a little bit about recovery. Hopefully that helps you.